Today, we're diving into the practical realities, the day-to-day, of caring for someone who uses a wheelchair because of cerebral palsy or CP. We've looked at, well, quite a bit, medical guides, caregiving resources, expert insights, trying to piece together a clear picture for you.
And the aim isn't to overwhelm, right? It's more about getting a real handle on the key aspects, the practical stuff.
Exactly. Clarity, valuable insights, that's the goal. So let's start at the beginning. What exactly is cerebral palsy?
Right. So at its core, cerebral palsy isn't just one thing. It's actually a group of lifelong conditions affecting movement and posture.
Okay, movement and posture.
Yeah. And the key thing is they stem from some kind of disturbance or damage that happened while the brain was developing. So before birth or in very early infancy.
And it doesn't get worse over time. That's important.
Exactly. That's a crucial point. It's considered non-progressive. The initial injury doesn't worsen, though the effects might change as a child grows.
Got it. So how does CP actually happen? What sorts of things increase the risk? It sounds like it could be complex.
It really can be. It's rarely just one single thing. The common thread is that damage to the developing brain.
Right.
Premature birth is a really big factor. We're talking maybe 40, even 50% of cases have prematurity involved.
Wow, that high.
Yeah. And having twins, triplets, multiple birth of that also increases the risk.
Okay. What else? What about things during the pregnancy itself?
Infections are definitely something to be aware of. Things the mother might get, like CMV, rubella, toxoplasmosis, even Zika, herpes, or certain bacterial infections affecting the pregnancy. Even a high fever in the mom during pregnancy or delivery, that's been linked as a potential risk factor.
Interesting. And you mentioned jaundice.
Yes, severe jaundice in a newborn. If it's not treated properly, it can lead to a type of brain damage called kernicterus, and that can cause CP.
So a lot happening before or right at birth. What about, complications during the actual delivery, like lack of oxygen?
Yeah, that's something people often think of first. And while things like, say, the placenta detaching or problems with the umbilical cord can affect oxygen supply and potentially cause brain damage, the current thinking is actually that most CP cases originate from factors before labor even starts. Prenatal factors.
Oh, okay. So birth asphyxia isn't as common a cause as maybe we thought.
It can happen, definitely, but it's considered responsible for a smaller percentage of cases than previously believed.
Right.
Other things include the mother's health, thyroid issues, seizure disorders, even intellectual disability have shown some correlation. Exposure to toxins like methylmercury is another one.
And fertility treatments.
Well, some assisted reproductive technologies are noted as potential risk factors, often because they can increase the chances of premature birth or multiple births, which we already know are risk factors.
It's quite a list. And I think you mentioned genetics might be involved too.
Yes, that's a really important area of ongoing research. It seems that genetic mutations affecting how the brain develops might be involved in perhaps around 14% of cases, maybe more.
14%. Okay. That feels like a significant shift in understanding.
It really is. And it could have big implications down the road for, diagnosis, maybe even treatment someday.
So once someone has CP, it affects them in different ways.
Yeah.
We hear terms like spastic, dyskinetic.
Mm-hmm.
For a caregiver helping someone in a wheelchair, what do these types actually look like day to day?
That's the key question for caregiving, isn't it? How does it impact daily life? Let's break down the main movement-related types.
Okay.
Spastic CP is the most common. Maybe around 80% of people with CP have this type. The main thing here is increased muscle tone, stiff muscles.
Right, like the muscles are always on.
Kinda, yeah. It leads to stiffness, exaggerated reflexes, sometimes jerky movements. It comes from damage in the part of the brain controlling voluntary movement.
And within spastic, there are different patterns.
Exactly. Spastic diplegia mainly affects both legs. You might see that scissoring gait if someone can walk. For a wheelchair user, it means potential tightness and positioning challenges in their legs.
Makes sense.
Then there's spastic hemiplegia, affecting one side of the body arm, usually more than the leg. That impacts things like pushing a wheelchair or using arms for transfers, maybe self-feeding.
Okay.
And spastic quadriplegia affects all four limbs, the trunk, often the face too. This is usually the most severe form, often meaning the person can't walk, needs a lot of support, and might have associated challenges like intellectual disability, seizures, or issues with vision, hearing, or speech.
That really paints a picture of the different levels of need just within the spastic type. What about dyskinetic CP?
Dyskinetic CP is quite different. It's about problems controlling movement. The main feature is involuntary, uncontrolled movement.
Involuntary, like movements they don't intend to make.
Precisely. It can look like slow, writhing movements, that's called athetosis. Or it could be rapid, jerky movements, chorea. Or even sustained twisting that leads to awkward postures, dystonia.
Wow, that sounds unpredictable.
It can be. Muscle tone can fluctuate a lot too, sometimes high, sometimes low. This affects the hands, arms, feet, legs, often the face and tongue too, which can impact sucking, swallowing, and speech.
Does it affect intelligence?
Often intelligence is completely unaffected in dyskinetic CP, which is important to remember. The damage is typically in a different part of the brain, the basal ganglia. For a caregiver, understanding these movements is key for safety during transfers, feeding, everything really.
And the least common type, ataxic.
Yeah, ataxic CP, maybe 2 to 5% of cases. This one involves problems with balance and coordination, damage to the cerebellum.
So more like unsteady.
Exactly, an unsteady walk if they can walk. Difficulty with precise movements like buttoning a shirt or writing. They might have intention tremor, shaking that gets worse when they try to do something specific.
How does that translate for a wheelchair user?
Maintaining a stable posture in the chair could be harder. They might need extra support for tasks requiring fine motor control.
And sometimes people have a mix.
Yes, mixed CP is quite common, maybe around 15%. Usually it's a combination of spastic and dyskinetic symptoms. And we should also quickly mention hypotonic CP, that's low muscle tone, sort of floppy muscles. Sometimes it's seen as its own type. Sometimes it's an early sign that evolves into another type.
It really underscores how varied CP is. So for someone using a wheelchair, besides just mobility, how does CP impact them daily? What secondary things do caregivers need to watch out for?
That's crucial. It's not just about not walking. The effects ripple outwards. Posture and muscle tone issues are primary, as we said, but these can lead to secondary complications.
Like what?
Well, sitting for long periods dramatically increases the risk of pressure sores or skin breakdown. That requires constant vigilance.
Right.
Abnormal muscle tone and limited movement can cause joint contractures, where muscles and tendons shorten, limiting how much a joint can move. That can be quite painful and affect function.
That sounds serious.
It can be. Also, for people who don't bear weight on their legs, their bones can become weaker, leading to what are called low trauma fractures, broken bones from minor incidents.
Oh, wow.
Hip dislocation is another big concern. Foot and ankle deformities, like the foot pointing downwards, hips and knees getting stuck in a bent position, even twisting deformities in the long bones.
And scoliosis, curvature of the spine.
Yes, scoliosis is relatively common, especially in individuals with more severe CP, affecting maybe 21 to 64%. The risk increases with higher GMFCS levels. That's a scale measuring gross motor function. And puberty can be a tricky time too. Growth spurts can sometimes make muscle tone worse and create new positioning challenges. So caregivers really need a proactive approach to managing these potential secondary issues.
Definitely highlights how much ongoing management is needed. Let's shift to best practices for caregiving, starting with personal care and hygiene. What are the key things for caregivers helping wheelchair users with CP?
Okay, personal care is fundamental. Transfers moving from the wheelchair to bed, toilet, bath are a huge part of the day. Safety is absolutely number one for both the person and the caregiver.
How do you ensure safety?
First, you really need to assess how much the person can help. Then, get the environment ready, clear space, equipment handy, communicate clearly, tell them what you're doing step by step.
And for the caregiver themselves, body mechanics.
Non-negotiable. Wide stance, bend your knees, keep your back straight, pivot your feet, don't twist your back. Keep the person close to you, and never, ever pull on their arms or shoulders.
What kinds of transfers are common?
Depends on ability. Maybe an assisted stand pivot where they bear some weight, or using a sliding board to bridge the gap between surfaces. For those needing more help, a mechanical lift is essential.
Like a hoist.
Exactly. Could be ceiling mounted or a floor model. Using the right sling and knowing how to apply it correctly is vital. Proper training is a must. Even simple things like slide sheets to reduce friction during repositioning in bed can make a huge difference.
Okay, transfers covered. What about bathing and toileting? That seems like it could present unique challenges.
For sure, adaptations are often necessary. For bathing, maybe it's a bed bath if mobility is very limited, or using special equipment.
Like what kind of equipment?
Things like bath chairs or benches that provide support in the tub or shower, bath lifts. Handheld shower heads give you more control. Roll-in showers are great if possible, eliminating barriers.
Safety in the bathroom is key too, right? Slips, water temperature.
Absolutely. Always check the water temp. Non-slip mats are important. And think about skincare, gentle cleaning, thorough drying, especially in skin folds to maintain skin integrity. Good postural support during bathing helps too.
And toileting.
Again, equipment helps. Bedside commodes can be very convenient. There are specialized toilet chairs with harnesses, head supports, adjustable height. Even simple things like raised toilet seats or grab bars can make existing toilets more accessible.
What about incontinence?
Managing incontinence is often part of the picture. That means having regular toileting routines, using the right products, pads, diapers, and really meticulous hygiene to prevent skin irritation and breakdown, that incontinence-associated dermatitis.
Dressing is another daily task. Any strategies or clothing adaptations that make it easier?
Oh, definitely. Adaptive clothing can be fantastic. Look for things with easier fasteners, Velcro, snaps, magnets instead of small buttons or tricky zippers. Larger openings for the neck and arms help. Elastic waistbands are often easier.
And techniques?
A good general rule is to dress the more affected limb first and undress the less affected limb first. Make sure the person is in a stable, comfortable position, maybe sitting on the bed or in their chair.
Are the tools to help?
Yes, dressing aids like long-handled reachers, sock aids, button hooks can give someone more independence. And always, always encourage participation, however small. It fosters autonomy.
Really practical tips. Okay, let's talk nutrition and feeding. Swallowing difficulties, dysphagia, can be common in CP. How do caregivers manage mealtimes safely?
This is a really critical area. If swallowing is a concern, usually a speech and language therapist gets involved. They'll observe, maybe recommend tests like a video swallow study to see exactly what's happening.
And based on that,
Strategies will focus on safety. Positioning is number one. The person needs to be as upright as possible, ideally 90 degrees, or at least 60 if they can't sit fully upright independently. Good head and trunk support, stable pelvis, making sure the neck isn't hyperextended.
and staying upright after eating.
Often recommended, yes, for maybe 30 minutes or so. Postural techniques during the swallow, like tucking the chin, might also be suggested to help protect the airway.
What about the food itself? Textures.
Modifying food and liquid consistency is very common. This could range from purees to minced and moist foods, soft bite-sized pieces. Liquids might need to be thickened slightly, mildly like nectar, moderately like honey, or even extremely thick like pudding.
Are some foods trickier than others?
Yes, things with mixed textures like soup with chunks can be hard. Dry, crumbly foods like crackers or hard candies are often avoided. Any changes should be introduced gradually.
And the actual feeding process, techniques.
Pacing is important. Don't rush. Use the right size spoon. Place the food on the middle of the tongue, not too far back. And there's lots of adaptive equipment.
Like special cups or forks.
Exactly. Cups with cutouts for the nose, plates with high sides or guards, spoons or forks with built-up handles, angled utensils. Whatever helps the individual eat safely and maybe more independently.
Is there therapy for swallowing itself?
Sometimes oral motor therapy is used, exercises for lips, tongue, jaw, chewing. The evidence for how much it improves the swallow itself in CP varies, but it might be part of a wider program.
Okay, shifting gears to mobility and exercise. Beyond the wheelchair itself, how can caregivers support physical well-being?
Well, first, the wheelchair itself needs to be right, properly fitted, providing the necessary postural support and pressure relief. Could be manual, powered, or tilt-in-space for pressure redistribution.
And physiotherapy.
Absolutely essential. A physiotherapist designs programs for stretching to maintain range of motion, prevent those contractures we talked about, and strengthening to maximize whatever functional ability is there.
What about standing or walking aids?
Yes, things like standing frames are really important. Weight bearing helps bone health. There are different types: prone standers, supine standers, sit-to-stand frames. Gait trainers can also be used to support walking attempts, helping with alignment and balance.
How are gait trainers different from regular walkers?
Gait trainers usually offer more support for posture and alignment. Standard walkers provide more balance support, maybe for leg weakness. Sometimes walkers are used facing backward to encourage better posture. Many have seats for rest breaks.
And just general exercise.
Regular physical activity adapted to their ability is so important. Prevents deconditioning, boosts mood, overall well-being. And finding ways to participate in adapted sports or recreational activities can be incredibly beneficial.
Communication and emotional support feel just as vital. How can caregivers best support someone, especially if they're nonverbal?
Absolutely critical. For nonverbal individuals, AAC augmentative and alternative communication is key.
What does AEC look like?
It's a huge range. Could be simple picture boards, communication books, eye gaze systems, or high-tech speech-generating devices like tablets with special software.
And interaction.
Social interaction is fundamental for developing communication skills however someone communicates. Create opportunities, encourage all forms, gestures, signs, vocalizations using their device, validate their attempts.
And the emotional side, CP must impact that too.
Definitely. A secure caregiver attachment is the foundation. But caregivers need to be aware of potential emotional impacts, limitations imposed by the CP, how the world reacts. Helping navigate social situations, maybe peer rejection, is important.
So building self-esteem.
Yes, fostering self-esteem, advocating for social inclusion, being their champion, and recognizing when professional support, like counseling, might be helpful for the individual or the family.
How can caregivers weave therapy goals, PT, OT, speech, into the daily routine so it doesn't feel like just another appointment?
Great question. Integration is the goal. Talk to the therapist, understand the exercises. Then, find natural points in the day.
Like?
Maybe do PT stretches during dressing or bath time. Practice transfer skills every time you move them. Use their AFC device during meals, playtime. Reading a story not just in a practice session.
So make it functional.
Exactly. Make it part of real life. And leisure activities count too. Reading, music, adapted games, they're engaging and can reinforce therapy goals.
We've touched on how demanding this is. Caregiver self-care, it's not optional, is it?
Absolutely not. It's essential for sustainability. Burnout is real. Caregivers need to recognize the signs.
What are those signs?
Things like constant exhaustion, feeling irritable or overwhelmed, maybe emotionally numb, changes in sleep or appetite, getting sick more often, finding it hard to cope with daily tasks.
What helps prevent burnout?
Respite care is a huge one. Getting a break, even a short one, is vital. It lets the caregiver recharge, tend to other things, maybe just sleep. Organizations like UC2 or the AirCH network can help find respite options.
And support networks.
Crucial. Lean on family. Friends, be specific about what help you need. Connect with other parents or caregivers and support groups, they get it. And use professional support therapists, doctors, case managers.
Any specific stress management techniques?
The basics matter. Try to get enough sleep, eat well, get some exercise, even just a walk. Take small breaks during the day. Learn to set boundaries. Say no sometimes. Don't hesitate to seek professional help for yourself. And make time for hobbies, things you enjoy. You have to refill your own cup.
Let's talk about the end of the day. What does a good evening and nighttime routine look like for a wheelchair user with CP?
Consistency helps signal it's time to wind down. The evening meal needs the same attention to safe swallowing, textures, positioning. Medication administration happens then too.
Hygiene routine.
Usually bathing or washing up happens in the evening. Using those safe transfer techniques, adaptive equipment, thorough cleaning and drying, especially skin folds, is key. Don't forget oral hygiene, brushing teeth.
And then positioning for sleep. That sounds critical.
It really is. Nighttime positioning is vital for preventing pressure injuries using supportive mattresses, special cushions. It's also for comfort, better sleep quality, and it's a key time to manage muscle tone and prevent contractures.
How does positioning help with tone and contractures?
You can use positioning for sustained stretches, like keeping hips or knees straighter, using pillows or wedges, maintaining good body alignment, symmetrical, neutral if possible, or accommodating existing contractures is the goal. Specialized sleep systems might be needed.
What about things that disrupt sleep?
Good sleep hygiene helps a consistent routine, calm activities, a dark, quiet, comfortable room. But you also need to assess for problems like pain, seizures, breathing issues like sleep apnea, reflux, or just the need to be repositioned.
Could medication like melatonin help?
Sometimes it's considered, but always under specialist guidance. If sleep is a persistent problem, seeing a sleep specialist might be necessary.
Okay, looking at the bigger picture now. Living well with CP as someone gets older. What does that involve?
It involves creating an enabling environment. That means physical modifications to the home, school, workplace, and having reliable assistive technology for mobility, communication, daily tasks.
And advocacy.
Constant advocacy is often needed, fighting for inclusion, breaking down barriers, physical ones, but also attitudes and systemic ones, in the community, school, jobs.
What about work for adults with CP?
Vocational rehabilitation services are important for teenagers and adults. They help assess skills, provide counseling, connect with training programs or job opportunities. Options vary hugely depending on the person's abilities. Computer work, research, writing, manufacturing, service roles. Good assessment and counseling are key. Understanding disability rights in employment is also vital.
In other aspects of adult life, relationships.
Absolutely. People with CP have the same needs and desires for relationships, intimacy, sexual expression as anyone else. Disability shouldn't exclude them from a full life experience. Caregivers should support and encourage this, not be a barrier.
What about long-term health management?
It requires a team approach. A primary care provider coordinates overall health, preventive care manages chronic issues. But often, specialists are needed: developmental pediatricians, neurologists, orthopedists, physiatrists. The caregiver is often the central coordinator, the advocate. A case manager can sometimes help coordinate services too.
Dental care. Is that different?
Regular dental care is crucial, maybe even every 6 months, starting young. Issues like altered saliva flow, chewing difficulties can increase risk. Gum problems or cavities need monitoring. Finding a dentist experienced with patients with disabilities, perhaps a pediatric dentist, is often best.
Are there specific medical problems caregivers should be aware of that are more common with CP?
Yes, unfortunately. Neurological issues like seizures are more common, different types, generalized or focal. Orthopedic problems we mentioned, hip dislocation, scoliosis, foot issues need ongoing monitoring. And secondary health problems can arise, like poor nutrition leading to growth issues or aspiration causing pneumonia.
So being vigilant for signs and symptoms?
Exactly. Recognizing potential problems early and seeking the right medical care is crucial for long-term health and well-being.
This has been incredibly thorough. It really paints a picture of the complexities, but also the strategies involved. If we had to boil it down to a few key takeaways for you listening.
I think first, remember just how varied CP is. Every person is unique, so the care needs to be truly individualized.
Right. Not one size fits all.
Definitely not. Second, while the brain injury itself doesn't worsen, the person's needs change over their lifetime. Secondary conditions can develop,
Yeah.
so caregiving requires ongoing learning and adapting.
And
Third, it's just so multifaceted. It's physical care, yes, but it's also understanding communication, supporting emotional well-being, advocating for inclusion, fostering independence, and remembering the caregiver needs support too.
it's clear that with that kind of knowledgeable, dedicated support, and, importantly, inclusive environments, people with CP absolutely can lead meaningful, fulfilling lives. Thinking about everything we've covered today, all the different areas of support, what single area do you think might have the most profound impact on quality of life for both the person with severe CP and their caregivers? Just something to think about.
That's a tough question, isn't it? So many things are interconnected.
It really is. Thank you so much for sharing all this insight during our deep dive today. For those of you listening who want to explore further, organizations like United Cerebral Palsy and the Cerebral Palsy Foundation have excellent resources available.